Medical studies from around the world are discovering that there is a simple and lesser-known protocol that without exercise or medication, you can lower your blood pressure, increase quality of sleep, increase circulation, increase oxygen intake, and increase your life and health span along with many other benefits. It's called Inspiratory Muscle Strength Training, and it is a simple breathing device that you use for a few minutes each day. This is what it looks like, but let's see what the science says. Cardiovascular health. Those who did the IMST breathing exercise had a 9-point drop in their systolic blood pressure. Quote, a reduction which generally exceeds that achieved by walking 30 minutes a day for 5 days a week. Quote, that decline is also equal to the effects of some blood pressure lowering drug regimes. What's more, even after 6 weeks they quit doing the IMST, they maintained most of that improvement. So it's more effective than taking up walking for 2.5 hours a week or using blood pressure lowering medication. Dyspnea is a medical term for shortness of breath, which goes hand in hand with cardiovascular issues like heart failure. After 4 weeks of IMST, patients with a heart failure had a 17% increase in oxygen intake. That can be the difference of carrying oxygen around or not. The users also enjoyed a 29% decrease in dyspnea or shortness of breath, a 24% inhale improvement, and a 13% exhale improvement, which makes perfect sense. People that use this also have a 45% increase in arterial diameter. That is a huge improvement, which translates into an enormous reduction in the risk of cardiovascular disease and an increase in overall health. Better sleep. After 8 weeks of IMST, people are enjoying a 27% reduction in waking up in the middle of the night. Also, people with sleep apnea have a 75% reduction in the sleep apnea index. Those numbers are high enough for millions of people around the world to get off their CPAP machines. Chronic obstructive pulmonary disease, or COPD, is a progressive lung disease that makes it difficult to breathe. It often involves a chronic combination of chronic bronchitis, which is the inflammation of the airways, and emphysema, which is damage to the lungs' air sacs. After just 2 weeks of IMST, these people had a 407% increase in inspiratory muscle strength. In the same period, they were able to increase the distance in which they could walk by 63%. After 4 weeks, the same people had a 110% increase in peak expiratory flow, which is how quickly you can exhale the air from your lungs, and the maximum phonation time, which is how long they can hold a tone. That was increased by 132%. These are important metrics to measure overall respiratory health. These figures can be the difference of slowing down and even stopping the progression of the disease. Spinal cord injuries. Respiratory complications are a common concern for people with spinal cord injuries who require respiratory therapy, as it's so painful to breathe. But it can be almost impossible to do any kind of exercise with a spinal cord injury. This is where this IMST simple exercise shines because you can do it sitting or lying down. It was reported that people with spinal cord injuries using IMST had a 117% increase in maximum expiratory strength, a 113% increase in inspiratory muscle strength, with a 67% increase in peak cough flow. Stroke patients. Stroke patients enjoy a wide range of benefits. Due to weakness or paralysis, food often goes down the wrong way. However, when they used IMST, that decreased by 70%. They had a 168% improvement in peak expiratory flow, a 37% improvement in swallowing ability, a 94% improvement in the range of food intake, a 63% improvement in dysphonia, meaning how they communicate better, and a 72% improvement in how well others can understand them. Overall health. Did you know what the body's best indicator of longevity is? It's not diet. It's not exercise. It's not your genetics. It's not access to health care. It's not your socioeconomic class. It's not your weight or BMI. It's straight up lung capacity. It doesn't matter how you decrease it, inactivity or smoking, and it doesn't matter how you increase it, IMST, aerobic exercise, or lung strengthening exercises. Larger lungs directly equate to a longer life, and smaller lungs directly equate to a shorter life. They did a study with a young female with unhealthy lifestyle habits. She increased her interior arterial elasticity by 10%, peripheral elasticity by 86%, and it increased her lung capacity so much so that it gave her an estimated 6 years more life in just 2 weeks of IMST. Conclusion. These are all the benefits with unhealthy people. Now just think of what it can do for healthy and active people. This is called the breather, and you set it to your personal level, which is shown in another video, and the standard protocol is 10 breaths twice a day. That's it. And of course you can do more. When you forcefully breathe in and out of it, it's restricting the flow both ways. When you make demands on your body, especially your lung, it seems to tell the body to increase mitochondria function, which is tied to every single disease. It increases stem cells, which can fix any part of your body. And it seems to release more human growth hormone, which is the fountain of youth. These are the reasons why I think IMST has a broad range of healing or improving so many health metrics. Regardless of health conditions, from heart failure to athletes, I think everyone should have one of these little devices. It's as easy as leaving it by your TV and using it during the commercials. This is by far one of the cheapest, least invasive, and easiest things you can do. We sell them here at the clinic. Pick one up for you and your loved ones today.